Hello everyone, we are now going to go over the bone marrow flow cytometry from a 47-year-old woman who presents with redness and hives in the skin, and she complains of intermittent diarrhea. So we are not showing other panels, we are just showing a specific panel here, which is relevant to the patient's history. So if you see the first plot, this is CD45 versus CD117. And there is a population here that expresses very bright CD117. So 117 is positive on a variety of cells, right? Like your blasts, promyelocytes, and erythroid precursors, all these can be 117 positive. But 117 is brightest in mast cells. So we use 117 to gate the mast cells. So any population that is expressing very bright 117 is gated. And then in the subsequent plots, we can see if 117 is, these 117 positive cells are expressing any aberrant mast cell markers. So this is usually these mast cell tubes have CD2, CD25, and other markers like CD33. So let's see. Here in CD2, we see that these mast cells express partial CD2 positivity. They are positive for aberrant CD25. They're negative for CD3. They have CD33 expression, and they're pretty much negative for other markers here like 123 and CD15. So if we go to the patient's history again, this is a 47-year-old woman who has skin rashes and intermittent diarrhea. So systemic mastocytosis can present with, skin rashes and intermittent diarrhea, because where in whatever organs they go, these mast cells go and deposit, they can manifest symptoms in that organ. So skin is one, and GI is another that they commonly go and infiltrate. And in the bone marrow, you can see clusters of mast cells, which are atypical. Normal mast cells are nice and round and do not cluster. Here, there will be clusters more than 15 cells in one cluster, and they'll be spindle shaped, and they will have aberrant expression of CD2 and CD25. Tryptase will be elevated, and KIT mutation can be positive. So you need a lot of things to satisfy the criteria. As far as flow is concerned, you just try to see if there is an aberrant mast cell population. Both normal and aberrant mast cells can express CD117. CD2 and CD25 are the markers that you have to focus on here. CD25 is very easily positive on the aberrant mast cells. Almost 90% of systemic mastocytosis will express CD25, but CD2 is less commonly positive, although it is also one of the definition for aberrancies in mast cells. So when you report these cases, never call it systemic mastocytosis, because remember, you need to fulfill those criteria, and you need your bone marrow specimen for that. And here you will just say aberrant mast cells identified, and you will give the percentage and describe the phenotype. Thank you.